everybody. My name is Dr. Christopher Greider. Welcome to another fun episode of Fun Facts at the Pharmacy. If you've never tuned into this show before, the intention of this show is to kind of give you information about different health topics that are current so that you can make the best decisions possible when you're there, either at your doctor's office, at a pharmacy, or if nobody's around that you can ask. This way you can actually do something correctly and not get yourself hurt in the process. So, kind of starting off the beginning of this show, we have our first segment, which is fast acting. The idea behind this is we kind of talk about something current. The one thing that I wanted to talk about with this current time of the year right now is that we're nearing the end of flu season. But the problem is that with flu season, this season has probably been one of the worst ones that's come around. A lot of people have been asking me questions in regards to, was it worth getting the flu shot this year? Should I have gotten the flu shot? Should I still get the flu shot? Now, the main thing is you have to understand the flu shot this year wasn't as effective as it has been in previous years. The CDC has recently released some information stating that it was only 36% effective this year. The problem with that is that it means that the viruses that they were trying to hit, there's different types of flu strains that are out there. The ones that they aim for every year when they do make the flu shots are kind of their best guess in regards to what they think are going to be the most ones running rampant for the year. They did guess this year, but they guessed wrong and there was a mutation. So the main strain that affected everybody was one called H3N2. Now, a lot of people don't normally know what those mean, but it's just different strains of the flu virus. So a lot of people are familiar from years ago. H1N1, when that had that mutation, was the big thing that everybody talked about that caused a lot of problems. Well, this year, H3N2 was the main problem, and it's one that you're not typically treated with in regards to the flu shot. However, the main thing to remember, and according to the CDC, the best thing you can ever do is make sure that you get your flu shot. Because even at 36% effectiveness, it still means that 36% of people that did get the flu shot were unaffected by it. And for a lot of patients, they found that it was actually beneficial to help reduce how long the symptoms lasted for. So you're not dealing with, the achiness, the soreness, the tiredness, the cough, nearly as long as somebody who didn't actually go out and get it. The other thing is it helps to protect you and everybody else that you love around you so that you're not spreading something to them and potentially giving them a problem. This mutation, the main concern about it was that it was affecting tons of healthy individuals and people that were still young, anywhere from the ages of 20 all the way up to 60. So we're talking young adults to regular adults that had no previous histories of problems with their immune system. People were dying from this. So that's why they really want to stress the point that making sure you get your flu shot is important. The other thing that some people had heard was that it was only 10% effectiveness. Now, the one thing you have to understand is this is across the world is what they're looking at. So when we're talking 36%, we're talking within the US itself. Give you an example, 10% was actually from Australia, which is where they sometimes use to assume how effective the flu shot's going to be, and 17% effectiveness in Canada. So when you hear those numbers, just remember that it was actually more beneficial in the US than it was anywhere else. So make sure that you're getting everybody their flu shots, because right now we don't want anybody else passing away from something as simple as being vaccinated against it. If you do have any problems that you think you believe you had the flu, it's not a bad idea to at least talk to your doctor. There are different symptoms that you experience from that versus a cold and seasonal allergies. The most common thing that separates them out is that most people run an extreme temperature. So they're running a fever of anywhere from 101 to 103. They have a severe nausea, severe diarrhea, and severe vomiting. If you experience any of those on top of a cough with stuffiness, runny nose, there's a good chance that you may actually be dealing with the flu, so it's not a bad idea to go in and get it checked out. They do have medications that are available as prescription, but the main problem with a lot of those medications that people have a hard time understanding is that it reduces the symptoms for how long they last. And the main thing is, to get the most benefit, you actually have to treat it 2 days before you even start having real symptoms, which most people don't even know that they have the flu. So with that in mind, make sure that you're using preventative means of keeping everything away. So make sure that you're washing your hands, make sure that you're keeping yourself clean. And if you are sneezing or coughing, make sure that you're keeping it concealed and keep it within, say, your arm. They jokingly say to dab, even though I know some people don't really understand that. But if you essentially cover your mouth whenever you're sneezing or coughing, it reduces the likelihood of spreading the disease. So please keep that in mind. We are near the end of flu season, so it should start to get better for most patients, but you still have some people dealing with it. if you haven't been immunized yet, so you haven't gotten your flu shot yet, you can choose to get it done for right now, but I still would recommend getting a new shot done around October, which is what the CDC recommends. So kind of wrapping that up right now, we're in the month of March right now. So with March, there's something that a lot of people don't know. The fourth Tuesday of every March is actually dedicated to Diabetes Awareness Month. So to kind of help talk about our main segment, which is focused on diabetes, I actually have a student with me. His name's Ben, and he's from Northeast Ohio Medical University. Hey, Ben.
Hi. So yeah, my name is Ben Ash. I'm a fourth-year student at Northeast Ohio Medical University. Hopefully completing my schooling to finally, get on to my professional career at some point here. But yeah.
Absolutely. Yeah. Well, I'm glad you're here with us today. The idea of today is that we're going to kind of talk about diabetes. So, I mean, for the general public, people hear the term diabetes all the time, or they hear like, oh, be careful of your sugars. What is diabetes ultimately?
So diabetes is pretty much characterized by just a long-standing high blood sugar level, or what they would call a blood glucose level. And so that high blood sugar level for a long period of time can cause a number of complications throughout the body. So basically having that for such a long period of time, not controlling it, can cause a number of different complications that we'll be going into.
Yeah, so it can lead to a lot of different problems. So with diabetes, because I know a large portion of the U.S. is affected by it, like how many people are typically affected by diabetes overall?
And so if you're thinking of the different types of diabetes, there's the type 1 and type 2.
Okay.
So with the type 1 diabetes, it's characterized as about 5 to 10% of cases. Okay. And then actually they've figured out with type 2 diabetes that people in the United States greater than the age of 20 can account for 11% of the population having diabetes. So it's pretty widespread, and that's a staggering amount of people in the United States.
Yeah, so that would be one of the main differences when you're talking about it, because like you mentioned, diabetes is two types. More often than not, younger patients, would you say, are typically affected by type 1, and then you have typically your older patients are the ones that are normally type 2.
So type 1, more so it's caused by more of like that genetic predisposition to the disease. So it's kind of, you can think of the body attacking its own self in a way. So it attacks the pancreas's ability to create what's called insulin, which would basically control the body's way of taking that sugar in your blood and taking it into the cells.
Okay.
So that would be kind of, so after you'd eat a meal, you'd have that high blood sugar, and then your body would respond by releasing insulin, which would be from that pancreas.
Yeah.
So with type 2, on the other hand, it's more caused by insulin resistance, quote unquote.
Yeah.
And so basically with that, if you were to have, poor diet for a long period of time, or a number of different risk factors that can feed into it, it's more a disease that can arise from just chronic exposure to, a poor diet, that type of thing.
Yeah. So most of the time we're talking, what are things that people should be looking out for? Because if you have no clue whether you're diabetic or not, you have no clue with your diets, with weight gain, things like that, what are things that people should be looking for that could indicate potential diabetes?
So there are a number of different risk factors that could feed into the disease itself.
Okay.
And so one being just if you have a family history, so if your mom or dad or even grandpa were affected with the disease, it actually has been shown that you have a higher incidence of acquiring this disease.
Okay.
Also, I think the number one player is just poor diet. So having this chronic poor diet for a long period of time, not exercising, really feeds into it. So it's more of this like metabolic disorder as well. Okay. Additionally, obesity can feed into it.
Okay.
And then also just having what's called like high lipid levels or high triglycerides.
Okay.
And that can be done, you can have a couple of labs drawn which can show that if you have like these high fats or high lipids in your blood, that actually could increase the risks of developing a type 2 diabetes as well.
Okay. So that's kind of the main thing, is just knowing family history and just keeping out for your diet for the most part. Yeah.
There's plenty of other cardiovascular risks as well. So high blood pressure also is another risk factor that can increase your risk of developing type 2 diabetes.
Yeah. So one of the things that we come across, especially with diabetes, is that there's all these risk factors associated with it, but what are some like tell signs that you can tell anybody that, how would somebody know if their blood sugars were too high?
So having a long-standing high blood sugar can cause symptoms of hunger, also can cause excessive thirst, and then also excessive urination as well.
Yeah.
So like that nighttime urination, a lot of diabetics can experience that. So basically with that excessive urination, it's kind of the body's way of trying to rid the excess sugar in the blood.
Yeah. So yeah, that's the main thing. If people notice that they're going to the bathrooms more frequently than they should be, that's always a good indicator of, hey, maybe something's not right, unless you've been downing tons of water all of a sudden. If you're drinking more liquids than usual, that may be an indicator for that. But if you're doing the same dietary things, nothing else has changed, and you're starting to notice that more frequently, that's normally a good sign too. The other thing that some people experience with diabetes is that if their blood sugars are kind of out of control, on rare occasion, they actually do tank to the lower end where it drops low. So what would somebody be looking for if their blood sugar was low?
And so if the blood sugar was a little bit too low, less than 70, let's say, which is dangerously low, you can experience symptoms of a high heart rate or like that irregular heart rate that you may experience. Also, you could be very tired. I know if your blood sugar is almost too low, it can almost comatose you in a way. So it's very good to keep in mind that you need to keep track of your blood sugar as well.
Yeah.
So another symptom is sweating. That's characteristic of low blood sugars too. So there's just some symptoms to keep in mind.
Yeah, so if you do notice any of those, it could indicate that your blood sugars are low. The other thing that we always want to be careful about too is if people start to feel real dizzy, if you feel real out of it, blurred vision, those are some other things that we always say just kind of keep an eye out for. Well, perfect. So talking about that a little bit, what are some normal levels for blood sugar? Because I know you just mentioned something about less than 70 being kind of scary. So for a normal person, if they were functioning, what would their blood sugars normally look like?
So it's usually less than 126.
Okay.
That's your normal blood sugar. And then if it's greater than 126, this is before eating any meals, then that's considerably high, and that could be indicative of type 2 diabetes.
Okay.
Or type 1 for that matter as well.
Yeah. And just kind of talking about that, because you mentioned it without eating anything. What about if you did eat something? What would be a good level?
So they can do what's called like a random glucose tolerance test. And so if that random level does come out to be greater than 200, that is concerning.
Okay.
And so that could be indicative of diabetes as well.
Okay. So we want to kind of keep it on the lower end of 200 then if possible. Okay.
And so these ranges, if you were to develop this disease over time, you want your blood sugar goals to be between 70 and 130.
Okay.
That is typical, and that's before meals.
Okay.
Now after meals, less than 180 is a good goal.
Okay.
So with 180, in studies, they found that any blood sugar greater than 180 it's kind of started to show those complications that we will be talking about.
Okay. Yeah. The other thing that we always want to look at too is that's kind of looking at the daily levels. So there are different testing devices that we do have. Glucometers are probably the biggest thing right now. So there's different testing devices, and the way they all work is a little bit different, but they're all measuring that exact same thing. They're looking for that number right there. So the main thing we always want to make sure is that people are aware if you are using any of the glucometers out there. So there's different companies that make them. There's One Touch, that's a common one, Freestyle, True Metrics. There's just so many varieties of them. The main thing is just to make sure that the testing devices and the testing strips that you use, those have to go together, because if they don't, your readings are going to be off. I've had patients that have come in saying, for some reason, my numbers seem off for whatever reason. They've used the wrong testing device, and for some odd reason, their blood sugars skyrocketed when they're normally around like the 180 that we were talking about. They skyrocketed to the 300 because the device isn't measuring it properly like it's supposed to. So I always tell people, just make sure that you have the right testing stuff for it. They are all available without a prescription. However, I will be honest with you, the test strips themselves are where a lot of people get caught with the cost. The devices normally run anywhere from approximately $10 up to about the $20 range. But the test strips themselves, if you go with the fancier models or anything like that, especially with the One Touch, you can be looking anywhere from $25 to $150 for just a small supply. There are variations that do exist out there that may be cheaper alternatives, so it's a good question to always ask your doctor or your pharmacist. And if you have any problems or concerns with those things, just make sure that you're actually talking to your healthcare providers. So we're talking doctors, nurses, pharmacists. We're all trained to kind of help everyone with those devices so that you know what you're doing with it and that you're getting the correct readings as needed. One of the other tests that I always hear from patients that they always bring up to me too is something called an A1C. So can you explain a little bit as to what that is?
So over time, a portion of the red blood cell, known as hemoglobin, can become embedded with sugar.
Okay.
If you were to have that chronic, long-standing high blood sugar for that period of time, and so it kind of goes with the life cycle of the red blood cell, which is about 3 to 4 months, and so it gives you an idea of how well is your blood sugar controlled or how poorly is it controlled over the 3-month span. So it gives you that average of those months.
Yeah.
And so it's a very good tool, especially if you haven't been to the doctor's office for quite some time, or if you're not self-monitoring your blood glucose very well. Doctors or even pharmacists for that matter can see that A1C level and see where you're at, where you're standing with your diabetes.
Gotcha. So you'd say it's kind of like a 3-month snapshot as to what's going on.
Yes.
Okay.
Yes.
Yeah. So that's the main thing. The A1C. What numbers are we typically looking for somebody that would be not diabetic, so to speak?
So less than 6.5% is typical.
Yeah.
Greater than 6.5%, usually that 6.5 to 7%, is kind of indicative of maybe prediabetes, but greater than 6.5% is usually a number that diabetics may have.
Okay. Yeah. And then if you are actually diabetic, I know we're aiming typically for under 7% is normally what they're looking for.
Yep.
So with that, we always want to be on the safe side with it. As you can see from the picture that I have here, this kind of shows you guys exactly what's going on with it. So if you look, the picture that's to the left right there is if somebody's A1C level was on the lower end, the red blood cell is in the center, so it's that big circle that's right there. And surrounding it in those little circles is actually sugar molecules. So when your A1Cs are lower where they're supposed to be, you'll kind of see some of the sugar kind of sticks onto those blood cells. But to be perfectly honest, if you look to the image to your right, when it's out of control or it's running extremely high, you'll see that it causes kind of like a bunch of sugar molecules to stick on. So you've got a bunch of these circles that are latching onto these red blood cells and going through. Now, one of the concerns about that is that if you have too much sugar that's being attached to your blood, it almost makes your blood kind of turn into syrup is the best way to think of it. So normally you think of it kind of like a free-flowing, like almost like a liquid flow, but if you have too much sugar, it kind of makes everything stick together more. So that's what causes a lot of your problems is because now everything's starting to thicken up. So we always want to be on the safe side with something like that. But kind of looking at that, and now that we kind of have an idea of what we're looking at, what are some of the short-term and long-term effects if your blood sugars are running too high and you're not controlled, so to speak?
So from having long-term exposure to high blood sugar, it can cause a number of different complications. Ones that actually we need to monitor for if you do have diabetes. So a number of them being retinopathy, which is basically after the retina, the small blood vessels in your retina are exposed to that high blood sugar, it can cause damage to your eye. Yeah. And so it can cause blindness after long-term exposure. Yeah. Another is what's called nephropathy, which is more kidney damage. High glucose in that area of the kidneys can cause damage as well. And that is also more of like a long-term complication to this disease as well. Additionally, there is what's called peripheral arterial disease. And with that, with diabetes, it can kind of mess up the small vessels or arterioles, if you will. Yeah. And so with that, you might experience like a lack of blood supply. So for example, a lack of blood supply to your feet. So I think it's always important to counsel anyone who has diabetes to take care of their feet in any possible way. Washing them accordingly, always wearing shoes, that type of thing, so ulceration doesn't develop in the feet.
Yeah. So that's kind of what we're looking for, is we want to make sure that everybody's body is essentially functioning, because the human body is an amazing thing. Everything is related to each other. So like you kind of mentioned, the biggest concern and the most common side effect that most people deal with high blood sugars is that neuropathy that you're mentioning. So the other thing that this does too is if you're not having proper blood flow, it causes the loss of sensation. So that's where those ulcerations that you mentioned would kick in. And we want to make sure that people are taking care of their feet, because that can cause a lot of problems where you can cut yourself open, get a wound that gets infected, and you wouldn't know it or feel anything right away until problems kind of develop from there. So with kind of looking at that right now, the short term, there's not much going on really, because people don't know if your blood sugar is too high or too low.
Unless it's dangerously high.
Yeah. So if it's dangerously high or dangerously low, those are the only times that you'll get some of those side effects that we talked about and those problems. But for right now purposes, even if it ran a little high, nobody really knows. So that's part of the issue, why it needs to be checked out and why we need people to be aware of that. So now that we kind of talked about what people should look for and some of the problems with it, for treatment purposes, what do we have available right now for it?
So there are a number of different treatments that have come out over the years, since the 50s for that matter. Yeah. So there's a number of different oral agents, from metformin to glyburide or glucotrol. One of the mainstay of treatments, it's considered a first-line treatment, is with metformin. They'll add that on first to see how your blood sugar responds. Yeah. Let's say you're not adequately controlled with an oral agent, then they can add on what it's called more of an injectable agent. So with that, they could add on, if you've ever heard of Victoza or Byetta, Bidorion, those type of medications. But if your blood sugar isn't controlled for such a long period of time, or let's say your labs are coming back and they're not doing so hot, they can add on insulin at that point. And so, insulin, it tends to, they may wait more as a last line, but it can be added on right away if the severity of your diabetes is that high.
Yeah. So, and that's one of the main differences we want everyone to be aware of, is that the treatments that you use are typically based off of what type of diabetes you're dealing with. So to be honest, with type 1s, they call these patients insulin dependent. And the reason being is that your body no longer produces the insulin that we had mentioned earlier. So with those patients, the first treatment that you go with is actually insulin. You start there. But for anybody with type 2 diabetes, most of the time you don't necessarily have to go to insulin first. And I'll be honest, I'm just like everybody else. I'm not a big fan of needles. So the idea of having to poke yourself doesn't sound appealing to me. However, some of these agents that were mentioned, especially the oral ones, if they're not working as effectively as they should, then they sometimes add on the insulin as an additional therapy to kind of help keep everything under control. So, and if you talk to any of your doctors or physicians, that A1C number that we had mentioned earlier, where you want to keep it under either 6.5% or 7%, all of these medications have an impact that's different. So it's a good conversation to have with your doctor or pharmacist about what's best for you. Most of the time, they'll cover anywhere from about a 0.5% to a 1.5% difference. So it can help your numbers depending on how drastic it is. But like I said, for some people, you may not notice it if it's just slightly over the number, and they may not have to go using multiple agents or insulin right away for everybody. So make sure you're having those conversations with your doctor or with your healthcare providers to make sure that you're getting the correct treatment, and that all of them have a different side effect profile. So we want to be on the safe side and make sure that with your body in particular, you're getting the right treatment for that. Kind of talking about that then too is we have so many different medications that are out there, but what are some things that people could do at home that maybe, you're looking for maybe more homeopathic or maybe just something that doesn't require medication? What are some things people can do?
So getting your diet controlled is pretty much the number one strategy. Alongside medications. Okay. So what they call it is carb counting, and basically you're trying to moderate how much carbohydrate intake you have per day. Yeah. And so they call it, within that carb counting, are carb choices. And the ADA does kind of lay this out for you if you were to visit that site. But for example, one carb choice would equal about 15 grams of carbohydrates. And so for, let's say, women, for example, they're supposed to have 3 to 4 carb choices per day, men 4 to 5, and then, maybe 1 carb choice for a snack or 1 to 2 carb choices for men.
Okay.
So just keep that in mind, that it may be pretty intensive at first trying to get your diet under control, but once you start to realize what foods you can and cannot eat, it actually may become more easy than you really think it could be.
Absolutely.
Also, I think portion size is a big deal as well. So you kind of think about like fractioning your plate out in like pieces of pie. So let's say you have like a fourth of your plate with that starchy vegetables, such as, let's say, like potatoes, that type of thing. And then let's say a fourth of your plate with meats, and then 1/2 of the plate, or like what's left of it, is with the non-starchy vegetables such as broccoli or cauliflower, that type of thing.
Yeah.
So really kind of changing your diet is, I think, more important than just medication itself too, because that's essentially what caused the diabetes in the first place.
Yeah.
Yeah.
And then just kind of running along those lines, because diet's awesome, but one of the other things that people can do is exercise.
Exercise, of course.
Yeah. So what is recommended in regards to exercise?
So they do recommend about 150 minutes of just moderate intensity exercise per week. So if you just more like walking or jogging, or 90 minutes of vigorous activity per week. So if you're into that high intensity training or anything like that, that is recommended for per week. Yeah.
And the main thing is people need to understand also that the different intensities of exercise are broken down based on your heart rate. So simply getting up and walking, unless you have limitations or physical disabilities that prevent you from getting out, doing something is better than doing nothing. So simply getting yourself up and getting out and moving, even if it's to walk down to the corner, still plays a role. But if you're looking for that moderate to vigorous activity, your heart rate does need to go over 120, because that's when your body's functioning at its highest. So we need to make sure that you're functioning at that level. There are different heart rate monitors that exist out there, and different exercise equipment actually do contain those heart rate monitors, so you can kind of see how things are going for you. So, yeah.
Of course.
But yeah, I think that pretty much kind of covered everything for diabetes right now. If there are any problems or questions, by all means, please talk to your healthcare providers. Those are the main people that you want to talk to. They kind of have an idea of what to do in regards to treatment, or to help you figure out the best way to go about getting in shape, essentially. And we want to make sure that you're also doing everything that you would need to in your diet and your exercise. But medications may be necessary. It's not the mainstay for everybody, but we do our best to try and help you guys out as much as possible. So if you have any questions or concerns, make sure that you're talking to your healthcare providers. But for this week, I think we have the end of it here. I want to make sure everybody stays safe for St. Patrick's Day, because I know a lot of people go out there and have fun on that point. And we'll see you on the next episode.